The measles were previously thought to be eliminated here in Canada, but we now find ourselves in the midst of an outbreak in Ontario. We spoke with Dr. Galange of Halton Region Public Health for his advice as numbers continue to rise.
So right now, there has been unfortunately a significant surge in measles cases in the province. To put numbers to it, on average between 2013 and 2023, there's about 7 to 22 cases of measles on average per year in Ontario. Last year there were over 60 cases, and this year already, so starting in January 1st, 2025, we've seen over 100 cases. So there's been a very significant uptick in measles, and a lot of this is actually due to an ongoing outbreak which spans multiple provinces and multiple different health units. Unfortunately, in Halton, we haven't had any cases connected to this outbreak, but we have had some exposures, and our team has been extremely vigilant to make sure we keep the community safe. A really important message is that we wanted to convey is that even though the numbers are going up and we know measles is extremely contagious, it's almost entirely preventable with vaccination. So really wanted to hammer home the importance of making sure that you and your children are all up to date on your measles vaccines. And the other message that's important as well is if you might be vaccinated or don't know your immune status, please make sure you can confirm that for us, because that'll be very helpful to know that you're vaccinated and will really help if you are, heaven forbid, exposed to somebody with measles in terms of next steps and what we need to do for you.
98% of the current measles cases in Ontario are in unvaccinated individuals. And while some may be too young for vaccination and others ineligible, there are also those who are eligible but find themselves hesitant.
Vaccine hesitancy has unfortunately been something that has always existed to some degree, but we have seen quite an uptick of it post-COVID or post-pandemic. And measles vaccines, unfortunately, one of the vaccines included in that as well. There's a number of different factors that people might be a bit hesitant to it. For example, people might be fed up with just how many vaccines there are. Understandably, there could be a lot of anxiety around safety and things like that, especially when it's their children that are involved, and just questions around how effective vaccines are. But I'm glad you asked this, because I really want to hammer home that vaccines, especially the measles-containing vaccines, are extremely safe. They've been around for a long, long time, very tested, have been shown to be extremely safe. Most people don't have any side effects. The vast majority of side effects are just a bit of a sore arm or maybe a red arm. They're also extremely, extremely effective. So the measles series in Ontario is 2 doses, and the first dose is up to 95% effective at preventing someone from getting measles, and that number actually goes up to almost 100% with the second dose, and this is lifelong. So very effective and very safe, and not only for you, but for others who might not be immunized as well.
The MMR vaccine is available through your family doctor or walk-in clinic. For Halton News, I'm Jessica Kading.